Hi, my name is Kristen Whitmer, and I'm going to be demonstrating how to do a health assessment questionnaire. So hi, my name is Kristen. I'm going to be your nurse today. We're just going to go over a few questions that I just need you to answer as honestly as you can, okay?
Okay.
All right, I'm sorry. And your first and last name are?
First name Jonathan, last name Widmer.
Okay, and your date of birth?
September 27th, 1981.
Okay, and what is your marital status?
Married.
All right, so the first question, I just need you to answer these, like I said, as best to your ability. Can you tell me any current or past medical history for yourself personally? Any kind of heart issues, blood pressure issues, diabetes, high cholesterol, anything like that?
No.
No. Do you have a family history of any chronic issues, like the ones that I listed above?
Just a little bit of type 2 diabetes. Don't know which side because I'm adopted.
Okay.
And then skin cancer on one of the sides. Not sure.
Not sure which or what type.
No, that's the only thing that really ever popped up on the adoption paperwork.
Okay.
It came.
Okay. What kind of diet do you follow?
High protein.
Okay.
Chicken, beef, salmon for my seafood or fish, with potatoes and rice for carbs and vegetables like broccoli and green beans.
So average calorie intake, what would you say?
3,000 to 4,000.
Okay.
It's a little higher.
Do you smoke or chew tobacco?
No.
Okay, and how about alcohol? How many drinks per week?
3 to 4 per week, and usually beer or whiskey.
Okay.
Occasionally wine if we're changing it up a little bit.
Okay, and then do you drink coffee or tea?
Yeah, that's coffee. A little higher. It's black, and I do either 1 cup to half a pot.
Okay, per day. Okay. Do you take any kind of current medications, any vitamins or supplements?
No, unless you count whey protein, which I use just to add extra calories and protein.
Okay. Have you ever had any surgeries?
Only PRK for my eyes.
Okay. Any complications with that?
None whatsoever.
Okay. And was that recently?
Very recently, August 24th of this year,
okay.
2018.
How many times per week would you say that you exercise, and for about how long?
5 to 6. I always weight lift. It's about minimum of 30 minutes per day, and max an hour. Okay. And then if I do a minimum of 3 days per week of cardio for 30 minutes, and if I have a fitness assessment coming up with the Air Force, I'll increase it to 5 days a week, 30 minutes a day.
Okay. How many hours of sleep would you say you get per night?
About 6 to 8.
Okay. And
hours.
That's pretty solid.
Yeah,
okay.
For the most part.
Okay. So the next series of questions I'm going to be going through is basically we're going to be going through your body systems, through like heart, lungs, things like that, and trying to see if you have any kind of current issues with those.
Okay.
So your skin, do you have any kind of abnormal spots that you're looking at? Any moles? Are they red, white, or blue? Uneven shapes?
Just 2 red moles.
Okay.
They've been monitored my whole life. I've had my whole life, so no issues
problems.
there.
Okay.
No changes.
Any unexplained rashes or redness, itching?
No.
Okay. How about your hearing? Obviously, you've had the PRK, so vision has changed, but no complications with that surgery. What about any difficulty with hearing?
No. Excuse me. No issues with hearing.
Any like continual sore throats or difficulty swallowing?
No.
How about your teeth? You see a dentist twice a year?
Yeah, twice a year. A little bit of trouble with grinding. Solved the problem with the mouth guard, and then a little bit of trouble with gum recession, but we solved that problem with extra flossing and an electric toothbrush. I was brushing too hard, apparently.
Oh, okay, great. So teeth issues are pretty much...
Oh, yeah, no issues.
Okay.
For the most part, all real common, solvable problems.
Great. So respiratory is what we move on to, so your lungs. Have you ever had any trouble with shortness of breath, any difficulty breathing?
No.
Any kind of environmental exposure to like air pollution, things that you might breathe in on a regular basis that could lead to further issues?
I would say, I would say probably my job, work aviation maintenance for the Air Force, and then I also work quality assurance for the Department of Defense, both in industrial situations with air pollutants like jet fuel and sheet metal factory might have a little bit of metal. But other than that, it's all no one wears masks or any of that. It's not one of those situations where OSHA requires that.
Okay. How about cardiovascularly? So with your heart, have you ever had any issues with a racing heart? Any kind of chest pain that radiates?
No.
No. Okay. How about abdominal? So have you ever had any abdominal pain that wouldn't go away? Nausea, vomiting, diarrhea, constipation?
Nope.
Nothing like that. Okay, so you're pretty regular there. How about your muscles? I know you work out.
Yeah, no issues there.
Okay. Do you ever have any trouble with like your balance or coordination of movement? Anything
Nope.
that's okay. So we move on to genitourinary. Any kind of frequent urination, trouble urinating, increased urination at night,
No.
painful urination?
No.
Nothing. Okay. Have you ever had any kind of unexplained weight loss or weight gain?
No.
No issues with maybe saying increased thirst or hunger or urination all at the same time?
No.
Okay. So your immune system, or basically your blood, is where I'm going at now. Have you ever had feelings that you're just like extra tired or feeling very weak and you can't really explain it?
No.
Okay. Any dizziness when standing? So if you go from like a sitting position straight up to a standing, do you feel lightheaded or dizzy?
No. Not at all.
Okay. Okay, so that's all those. Next question is, what like role do you have in your family, and do you feel like it's an important role?
Head of household, I would say. Yeah, I do all the finances. I make sure everything goes right and everybody gets what they need.
Okay. Do you feel like this is an important role?
Sure. Yeah, absolutely.
Okay, what kind of work do you do? I know you said something about the Air Force and some industrial work, but what do you do for a living?
I'm a quality assurance inspector for the Department of Defense, where I inspect aircraft parts before the DoD purchases them and puts them on our aircraft.
Nice. And you're in the Air Force Reserves?
Yes.
Okay. And sorry, you said something about maintainer?
Aircraft engine mechanic.
Engine mechanic. Okay. Do you have any kind of cultural preferences? Any kind of ethnic background? Any kind of like preferences with your care when it comes to your culture?
No, not at all.
Okay. What about religion? What is your religious preference?
I would say non-denominational Christian.
Okay. So anything related to your health there that would cause any kind of stop in treatment?
No,
or...
not at all.
Okay. So we talked about your exercise. What kind of precautions do you take when participating in sports or doing your exercise?
Excuse me. Warm up sets. I don't really do any stretching. I should probably do a little bit more, but mostly just warm up sets. Something just get the muscles with some blood pumping into them, and nothing. Normally don't have any issues, but a little extra stretching as I get older would probably help.
Okay, and do you do anything other than the weightlifting?
A little bit of Brazilian Jiu-Jitsu or some martial arts of different styles, but for that one, I do quite a bit of stretching before, because without stretching, that'll go bad every time.
Doesn't work, okay. Great, so what is your highest level of education, and are you currently in school?
Bachelor's of Arts in History,
Okay.
and I'm currently in school for a master's degree in history and a graduate certificate in public policy.
Awesome. Okay, and finally, the last question, do you feel safe at home and safe in your relationship?
Yes and yes.
Okay. Well, Mr. Widmer, thank you very much. I really appreciate you answering all my questions.
All right, thank you so much.
Thank you.